Okay, we're going to go ahead and get started. We've got a couple of our speakers. We hear they're in the building, but I'm sure that they are probably being stopped along the way. But I do want to go ahead and get us kicked off. I am Dawn Walton. I am the current treasurer of the Board of Voices. And so on behalf of my fellow board members and the staff, I'd like to welcome you today. This is our 11th annual Child Advocacy Day. So we really appreciate you all being here. Before I forget, if you are going to be posting any of your activities today, pictures, people you're speaking with to social media, we would love for you to tag this. I'm not a social media guru, but I'm sure many of you are. But I'm going to put this up here, but it's hashtag Voices AAPCAD 2025. So we would like for all of your efforts and exciting things happening today to get posted and to get out there. So I'm just going to put this. And so as we conclude today, if you can't see it, please come on up. So a little bit about Voices. As you all probably know, we were founded in 1992. And so for more than 30 years, we have been speaking on behalf of Alabama's children. We've been the voice of Alabama's children through research efforts, through public awareness, and of course, through advocacy, which brings us here today. Many of you know us by our annual publication, the Alabama Kids Count Data Book. We are so proud to be able to publish that every year. It's really a vital tool in benchmarking child well-being across our state. Every county of our state is represented, and I think there's about 10 different categories of child well-being that we track year over year. What we love about that book is it informs us of the results of our work, whether it's programs, whether it's policies, or whether it's funding. It does show what a difference we are making, but it also helps guide our roadmap. And so many of the policies and things that we advocate come directly out of that Kids Count book. What we know on the child advocacy front is it takes a village. It is not something that Voices can do alone. It really takes each and every one of you in the organizations you represent. So we are just thrilled that you are partnering with us, again, to be that voice for Alabama children. What we want to do, and really our aim, is to not only raise public awareness, but really to educate and inform lawmakers. We want them to be informed so that when they are making vital decisions, that they have our children in mind and that we are giving them the best opportunity for success, be it around education, be it around health, just life in general. So I really thank you for being a part of that effort and for being here today. So with that, we will go ahead and kick it off with our first speaker. Dr. Norma Mobley is here. She is president of the board of the Alabama chapter of the American Academy of Pediatrics, and she wants to take a moment to recognize and honor the memory of one of our former child advocates, Dr. Mobley.
Okay, good morning again. As some of you already heard me mention him earlier this morning, this is Graham Champion. Perfect name because he has been a champion, not just for children in Alabama, but for the pediatricians of Alabama as well. He served the Alabama chapter of the AAP for many, many years with tireless, dedicated advocacy on behalf of children and pediatricians in Alabama. I think the best way for us to maintain his memory and his work is to maintain that level of dedication toward advocacy, and that's the best way that he can be remembered.
Good morning. My name is Apreill Hartsfield. I am the Policy and Data Analyst and Alabama Kids Count Director at Voices for Alabama's Children. And we just released our 2024 Alabama Kids Count Data Book. That's the 31st edition. We released that on Monday, so hot off the press, although they're not printed yet. But these are the numbers, just to give you a look into the data book. And it is on our website, so you can go online and download that. And if you want a hard copy, you can put in an order for that, and we'll get those printed soon. So as Dawn mentioned, we have been doing the Kids Count Data Book for over 30 years now. And what we do is we look at, for those who may not be familiar with the data book, we have 4 different domains that we measure child well-being: health, education, safety, and economic security. And under those 4 domains, we have about 70 different indicators. A lot of those are disaggregated by race, ethnicity, gender, and then on income, which is typically above poverty or below poverty. So we don't really have actual dollar amounts attached. This year, we took a slightly different approach to the Kids Count Data Book. We really took the economic security domain and made that the central focus of the data book. Why did we do that? Because when we were looking at our national data, for those who may not know, there's a national data book also. They're 2 separate books. They're 2 separate sets of data. So just so you know that. But when we were looking at the national data, what really stood out to us was that child poverty has pretty much been stagnant around 21% for the last 20 years. And so we wanted to take a look and see, what does economic security look like across the board? And our vision was for this book was, what would an economically secure Alabama look like for every child? And so we applied the economic security lens across the other domains. And what we found is that economic security, as you can imagine, interconnects. All of the indicators under that domain really interconnect with the other domains, the indicators in the other domains. Let me just, because I have so many numbers in my head, I want to be sure I'm telling you the right numbers. So I just want to jump in and let's see. Like I said, we've been stagnant around 21% for about 20 years on our child poverty. That means 1 in 5 Alabama children live in poverty. What does that look like? Well, the data is based on 2022 data, and during that year, for a family of 4, the poverty level was $27,750 a year. So if you can imagine a family of 4 taking care of a family of 4 on that income. And all of the income, as I was talking about, these indicators are interconnected, and so they affect each other. They can make each other better, or they can make each other worse. Some of the specific data points that we saw is that infant mortality rate it did decrease a little bit, but the state average is still 6.7 per 1,000 live births, and that's higher than the national average of 5.6 per 1,000 live births. African-American babies die at a rate that is about 3 times higher than babies of other races and ethnicities. Premature births increased from 11.9% in 2012 and to 12.8% in 2022. And these are comparing 2 points in time. So it's not looking at that whole time frame. It's looking at those 2 points in time just to get a comparison. And all these measures, as you probably know, because a lot of you are here from the medical community, but all of these measures go to look at infant mortality rate, premature births, and low weight births, look at how a child enters this world. And of course, infant mortality is the child did not make it past his or her first year. As the children get older, it's not a whole lot better as far as mortality. Child death rate also increased from 22.3 per 100,000 children to in 2012, compared to 25.1 per 100,000 in 2022. Preventable teen death rate also climbed. And just to point out that the 2 leading causes of death for children and teens across the state, the first is firearm incidents, and the second is our car crashes. So I'm happy to report, if y'all haven't already heard, the Child Passenger Safety Bill did get a favorable report out of committee this morning. So hopefully we are on our way to trying to improve the safety for children in cars, in auto vehicles. And then for children in foster care, the number remained pretty similar between 22 and 23. However, the number of children in care in 2023 was 7.6% higher than the number in 2016. That was the base year that we collected the data. The children with indication of abuse or neglect, that rate was higher in 2023 at 10.6 per 1,000 children than in 2013, which was at 8.7 per 1,000 children under 18. We do have some things to celebrate. And you've all probably heard the news about our test scores for math and reading. So in 2024, third graders made significant gains in English language arts, and a group that helps us with our data, the Public Affairs Research Council of Alabama, did an analysis of those scores. And what they found is that the English language arts scores increased from 53% in 2023 to 62% in 2024. The math scores, we got some really good national recognition on that. So the ACAP scores showed increased math proficiency in most grades, except for a slight decline in third grade. Fourth and fifth grades saw a 3 percentage point gain. And then for all the subgroups of students, the economically disadvantaged students saw the biggest gain, which was a 6 percentage point improvement. And that was what we got national recognition for, because that was the best in the nation. It's good to be the best in the nation on something for once. And all of this goes to what we also, with the data book, we were also trying to tie this to policies that we need and policies that are working. So the Alabama Literacy Act, the Alabama Numeracy Act, those investments are working, and we can see that with these test scores. So we have to keep those investments going. Also, college and career readiness also improved. And another area that saw improvement, and this is information from the Administrative Office of the Courts. Since the implementation of the Alabama Juvenile Justice Act in 2009, youth incarcerations are down 61.4%, and juvenile violent crime court petition rate is also down. The community-based approach that's prescribed by the Alabama Juvenile Justice Act, that's something else that's working. Keeping these children in their communities where they can be supported, where they can be mentored, instead of locking them up. And we know that there's a lot of other negative consequences that go with locking these children up. So that is also working. Those were the highlights. I encourage you to look on our website and download the data book. And if you have any questions, please feel free to reach out. Thank you.
At this time, Dr. Mobley is going to come and facilitate a discussion with our state agency heads who are all here. And we're just excited that you're here and that they're here again this year to inform what's going on in their departments on child well-being. So, Dr. Mobley.
Okay, I just had an opportunity to shake hands with those of you who were here earlier. So those that I didn't get a chance to meet one-on-one, I am Norma Mobley. I am the Alabama AAP chapter president, and I'm practicing pediatrician in Mobile. We will be asking each of you a few questions, and we'd like for you to make your replies out of consideration for all of your co-panelists to have an opportunity to answer as well, to try to limit your answers to 2 to 3 minutes. So the first question is, with so much happening at the federal level that could impact services for children in Alabama, what short-term steps are you taking now to minimize potential effects on children? We can start here with you, Nancy Buckner.
Well, actually, we're not taking any short-term steps. That's just not the way I work. I've been around a long time, and we've taken steps years ago, and then it got changed. So I've not gotten any official correspondence from anybody on the federal level, and we're heavily funded with federal money, as most of you all in this room know that. So until we get something official, we're not going to take any kind of steps. I promise you, whatever comes down, we will try our best to minimize how it affects our clients. But I just don't believe in putting stuff out there and getting everybody all excited and upset. When that first came out not long ago from the management office, which we didn't get, it was not sent to states. Somebody just got a hold of it and put it out there. We had elderly people calling and crying, thinking their SNAP was going to be cut off immediately. We didn't even know anything about it till we got that first call, and then we started looking for it. So I think there's a lot of hype out there. It may come, it may not come. What they ended up telling us later in the day, about 4 hours later, we got something else that had been sent to the budget office, again, not to the states. And it was like, we're not going to cut anything that it has direct benefits to people at this time. So like I say, we've got so much going on at DHR, I don't have time to speculate on what ifs out there. We're handling the day-to-day problems, which is what we will continue to do, and try to serve our clients in the best way possible. Thank you.
Okay, thank you. Superintendent Mackey?
Yeah, so we're similar situation, of course. Sorry, we're in a similar situation, maybe a little better. All of our indication is that funds are being increased. We've certainly had no funds frozen or taken away. Though I know there's been media talk about that, but it's not. But nothing has come down about it. I'm personally very excited because the nominated deputy secretary and 2 or 3 of the assistant secretaries are pretty good friends of mine. We've never had this kind of connection with the department. I was talking to a couple of them yesterday, so feel really good about the people that are going in. I know there's been talk about cutting discretionary funding, and there may be, and I know I've talked to a lot of my friends at the universities who are worried about it because they get a lot of discretionary funding. We get almost no discretionary funding. I mean, it's like less than 1%. And what we do have nothing's changed on it. But now our big funding pots, of course, are child nutrition, which doesn't go through the Department of Education. It goes through AG, which is our biggest source of funds. And then second would be special ed, which the administration's told us are probably going to increase funding for. There's been no talk about decreasing. And then Title I, which we think will probably be frozen. We don't anticipate any increases just based on our talks, but it's been frozen for several years now, so it's just kind of stabilized. But again, no talk about cutting. And then the other titles that go with Title I that are in the Elementary and Secondary Education Act. So Title II we use for professional development, class size reduction. Title III for English language learners. Again, those are not discretionary. They're formulaic, and they're approved by Congress. And for the next year, they've already been approved. So, we're not, until something changes. I mean, Congress could come back next year and say they're going to make all those cuts. But until they do, we're not reacting to it. And we don't. When we talk to our delegation in Washington, I mean, none of them are talking to us about preparing for cuts.
Yeah, I would say we haven't made a decision to do anything different, but we're worried. 4 weeks ago when, these announcements were made publicly, we actually did not have access to any federal monies for about 48 hours. We attempted, we received a letter in our grant portals Grant Solutions portal, which is how we interact with the feds over the funds we draw down, that just said everything's on hold. Essentially, it was unsigned. There was no one for us to respond to. And so for a Monday and a Tuesday, every attempt we had to draw down funds was denied. And then on Wednesday is when there was a court hearing, and then there was a hold on this executive order, and then suddenly everything opened up again. We've had a few grants that we've tried to pull down that have said, not available today, but after 2 or 3 days, they become available to us. So it really has been a concern for us. As of this morning, everything we've sought to pull down, we've been able to pull down. Public health's, more than 2/3 federally funded. Most of the rest of our funding comes from reimbursement we get from Medicare and Medicaid, which is also sort of federally funded, I guess, mostly. We get about 8% of our budget from the state general fund. So more than 92% is not from the general fund. So any freeze in federal funding would be disastrous for us. The current continuing resolution that funds HHS and those related services expires March 14th. I don't know enough to know whether we're going to have another government shutdown or not, but Congress will have to, solve that by March 14th so that we have another continuing resolution that continues to fund us. I think we fully expect that public health's going to get hit, from all the indications of the HHS leadership and others, they are more than likely going to pull money back. We just don't know which programs are going to be affected. And really, until this week, we've not had anybody even to discuss with. There's been a communication pause with the program officers that we relate with. They have finally started, they've finally been able to speak to us about certain things this week. So it's a lot of uncertainty. We're public health. We just do what we have to do. We'll find a way to keep taking care of people. I'm not worried about that, but I think the future is going to look different than the last few years have looked.
Thank you. Will the rest of the panelists please introduce yourself and which agency you represent after Dr. Harris, please? Thank you. That's okay.
I'm Steve Lafreniere. I'm with the Alabama Department of Youth Services. And, very similar to the previous panelists, if you watch news and media outlets, you'll have whiplash by the end of the week with, just trying to absorb what may be coming down. The good news for Department of Youth Services is the juvenile justice and that whole service continuum really is not dependent on federal funds. Most of it comes from the state general fund and ETF dollars for our department. We do have small Department of Justice grants that come to the state that may be held up. Recently, again, nothing official has come down as far as I have received, but in conversation with somebody who we are working with through a consultation grant who works with other states, some things have been put on hold as far as, administering dollars for grants. But that has not been officially here in this state. I'll have a meeting next Friday, as a matter of fact, with the State Advisory Committee that administers Title II Department of Justice funds through OJJDP. It's not a ton of money every year, but it does support programs in the community to help kids not get further into the system or to help prevent kids from getting into delinquent behaviors. Hopefully there'll be some report out from the DECA on that as to whether or not those funds will be affected. But that's a block grant that each state gets again, I have not received anything official on that. But other than that, the other big thing, though, and I'd be eager to hear from partner sister agency with Medicaid is we do use Medicaid dollars. And if that somehow gets affected, either eligibility wise or others, that could affect some of our community-based programs that we support evidence-based practices in the community to work with children and families to keep them in their communities or to divert them from coming into DYS. And so again, not to be an alarmist or to sound the bell, but we're really kind of watching what the feds may do along the lines of Medicaid for children as well.
Good morning. I'm Jane Elizabeth Burdeshaw. I'm the commissioner at the Alabama Department of Rehabilitation Services. If you don't know who we are, We serve individuals with disabilities and their families across the lifespan. Two of our programs, major divisions, are Children's Rehabilitation Service and Early Intervention. I would say for us, I would mirror some of the earlier comments. I've really set as my goal to make sure that I spread facts and not speculation. We have a lot of consumer groups that are calling our offices, as you can imagine, wanting to know, how might this impact me? And so my goal is to try and make sure that they get information as I have it available to me, stay in touch with our federal partners as best I can. Many of our programs are housed within the Department of Education. I do not have anything to tell anyone about funding, but I can say that more than likely there will be some changes. We do know that change is kind of inevitable right now. But what I would say, there's an old quote that says change is inevitable, but the pain is optional. And so our job is to try and prepare for those changes and think about how it might impact the families that we serve. For us at the department, short term, there's actually a lawsuit that's much more of a concern to us, and we have much more information about it than we do about some of these short-term changes that you're hearing about federal and state departments. And for those of you that don't know, Alabama is one of 17 states that entered into a lawsuit that not only questions the new rule that was placed, an ill-advised new rule that was placed 3 months before the Biden administration left office, and instead it questions the entire constitutionality of Section 504 of the Rehabilitation Act of 1973. And we as a state need to say, okay, if you want to question the rule or you want to move the rule, then let's do that. But let's not whittle away at the fabric of rights for individuals with disabilities. And so I've been in close contact with the governor's office, have created a news brief for her office. We've also reached out to the Attorney General's office to talk about how this might impact individuals and families with disabilities. So for us, short term, that is much more of an issue and something that we're paying close attention to.
Good morning, Barry Cambron, Deputy Commissioner, Alabama Medicaid Agency. Much like the rest of the panelists, we have heard a lot of things, but there's been nothing official. Commissioner Azar, who can't be here today, she sits on the board of an organization called the National Association of Medicaid Directors. So our short-term steps, if you will, would be we're monitoring literally on a daily basis what's going on at the federal level. Being heavily dependent on federal funds, around 73% of our funding is from the federal government. Any change in that would have a significant impact on our budget. And probably many of you have heard the same things that we've heard. There's talks of block grants, per capita spending caps, and other types of federal match rates cuts. So, like I said, we are monitoring that. It could have a significant impact depending upon the gravity of it. And at that point, we would actively engage with our state and congressional leaders. But at this point, I would say we're in a monitoring mode.
Good morning, Jan Hume with the Department of Early Childhood Education. We are, again, monitoring. We have very few federal funds, but we have not had a problem with drawing down any of our home visiting funds. Primarily, our home visiting program is funded through federal dollars through McVie, and we have not had any problems with that. We are monitoring. We house the Head Start Collaboration Office. And so we've been working closely, listening to see if there have been any problems there. Very similar to public health, there may have been a couple of days interruption in drawing down those funds for Head Start grantees. But other than that, nothing permanent. So again, we are just monitoring and watching and proceeding with business as usual.
Okay, thank you very much. The next question. What are you hearing in terms of legislative support for your agency's needs specifically pertaining to children? Yeah.
Well, there are always pretty receptive to what we do, but that doesn't mean they're going to be that way when they actually pass the budget. So we've got a budget request in. We haven't heard any negative comments about it other than what I've heard for probably almost 17 years now. You know how the money is, and we just don't have enough to go around to everybody's needs. So that's pretty standard language. Probably my colleagues up here, they all hear it too, just like I do. So, I think it's important for legislators to hear from you, because after all, children are the future of this state, and keeping them healthy and in good shape goes a long way. I mean, that is our future. And if we don't do that, we might as well not do anything. It doesn't matter to us if we don't keep our children. And sometimes we get focused on other things, not to say that there's anything wrong with doing the other things, but if you don't put children first, if a state doesn't, you will never have enough money to dig yourself out of the hole that you should have not been in the hole because you didn't fund children to start with. So that's my story, and I'm sticking to it.
Well, good story, I think. I'm good with that. We were real similar. The governor did an excellent job with the budget. Of course, we worked very closely with her and Finance Director Poole on developing the budget. Of course, we've really not had any hearings yet in the Senate, but we're not hearing anything negative, any pushback on the budget. It's actually, compared to many states, pretty robust budgeting here because, as you know, a lot of states are seeing cuts, and we're not proposing any cuts. I think it's about a 6% increase this year. Our focus, our requests they're the same things we've been requesting for a while. We're focusing on early math and reading. Something new that we got last year, we worked really hard to get a line item. We got $5 million for what we're calling struggling readers beyond grade 3. So that's to focus on really 4th, 5th, 6th graders for continuing reading interventionists and coaches in our most needy schools. $5 million doesn't go a long way, but the governor's doubled that, or more than doubled it this year. And again, we're not hearing any pushback from the legislature on that. I guess that's about it right now. I think we're still probably a month away from knowing what's going to come down with the budgets, but so far, all very positive.
Yeah, our major ask at Public Health has to do with the state share for CHIP, for the Children's Health Insurance Program. As you know, that program, the terrific program that happens to reside in Public Health. In a normal year, normal non-pandemic year, we see kids sometimes who sort of churn back and forth between either our agency or Alabama Medicaid, just depending on how much money their parents make this year. They make a little less, they go to Medicaid, or next year they make a little more, so they're eligible for CHIP. What happened during the pandemic is that the feds said that anyone who was enrolled in Medicaid could retain that coverage regardless of whether they had continued eligibility until the end of the public health emergency, if you remember. And so we had a lot of kids who churned over to Medicaid who maybe would have normally come back to us the next year or the next year. And by the end of the public health emergency, as Medicaid began their unwinding, we had over 25,000 less kids than we would have in an average year. So we actually were, for the length of the public health emergency, requesting less state share than normal. As Medicaid completed their unwinding last April or May, I think, I can't remember, we saw a jump of almost 30,000 kids in 1 year, back to sort of what our baseline is. So our ask for state share has increased similarly. So we requested about $28 million on top of our requests we had last year, for a total of over $80 million in state share for CHIP. Everyone's been very supportive of that. We're not, we're not anxious, I guess, about it, but it's a big ask. And as the budget gets tighter, I don't envy our budget chairs is they have to make these really hard decisions. But the governor's has been very supportive. Director Poole included that in the governor's budget. We've met with the budget chairs. They're very supportive. The legislature has been great with CHIP. It's just a great program, and we appreciate their support. So that's been our main ask. We're not, actually, it's been literally our only ask. We have no other requests for additional funding beyond that. So we feel okay about that, and we'll see how it plays out.
Yes, I think I got the same speech as Commissioner Buckner, and actually I got a pre-speech that don't come in here asking for a whole lot because it's not the same monies available that were before. But you know, the budget that the governor submitted was not everything we asked for, and that's usually how that works, though. So that's not unexpected, but it is an increase in what we've asked in the past. So we're pleased with that. There's a couple of initiatives that we want to address and need to address, and quite honestly, you know, one of the biggest issues that we have been struggling with over the last few years is having individuals come back to the workforce and have a quality work staff who works with our children 24/7, 365. We don't have a day off in direct care. Very happy to hear that over the last 15 years, we're down 61%. I'm familiar with that statistic that was given by Apreill about the number of kids in custody. Nationally, that number has gone down as well, and that actually is good for the budget because we can cost shift that into community and provide services in the community and wrap those children and families with services there, because it's quite costly as a per diem rate to have kids housed in state custody. And so, you know, we've been grateful for the support that we've received from the governor, and what we're hopeful for this year is that with her number one priority being public safety, that will create an awareness that public safety also includes the services and needs of youth, not just the adults. And so in her package of bills that she has one particular bill directed towards juveniles as well. So each of the bills looks at a certain aspect of public safety, from supporting, you know, law enforcement to also enhance monitoring and things like that would be beneficial for us. So we're hopeful. Would love to always have a little bit more to do some things, but I know one of the things that we are trying to provide is a competitive work environment that we can recruit the type of individuals who work with children, because that's really where the rubber meets the road and the difference is made in the lives of young people, is the adult standing in front of them. I've always said that kids follow people and not programs, and if you have the right people in front of them, you can get some real magic to happen sometimes. So, but we're hopeful that the budget will go through, and if the awareness of the need continues to increase, it may be opportunities for us to have discussions about the additional needs we have, and maybe the legislature can help by putting some of those monies that we requested back in the budget as well.
So for us, we're very appreciative to the governor, finance director, executive budget office, who met with us earlier this year to try and prepare for this legislative session. The governor's budget came out exactly like we asked it. And so we're very pleased with our budget so far. Our message to the legislature is, please don't mess with it. Not only will we see an increase in some important services, we also received an additional allotment recommendation through the Veterans Steering Committee. We house the state's traumatic brain injury program for children and adults, and we will be able to greatly expand those services, particularly to the veterans community, with those additional dollars if they hold throughout the legislative session. So we're very excited about that addition. I also want to say that one thing in Alabama that we're #1 in is our vocational rehabilitation program, and that's helping young people look at career pipelines and pathways as they exit high school and enter into the workforce. We are mandated to expend a 15% portion of our federal allotment on students with disabilities to look at career pathways and help them prepare for the world of work. Not only did we expend our amount, other states that did not, their money went back into a pool, and we were able to pull down what is called reallotted dollars into Alabama. So we were able to draw down some additional funds there as well to help students with disabilities in high schools across the state. So we're excited about all three of those things.
That's great.
I would say we're feeling optimistic. We've done a lot of educating this session, not only with the governor's office and EBO, but with our legislators. As many of you know, our request this year is just under $1.2 billion. And that comes as maybe a shock to some, because while our need has been roughly that, a little bit less in previous years, our ask has also been less. And that is because we have benefited during the public health emergency from an enhanced federal match, 6.2%. As Dr. Harris mentioned, we were required by the federal government to maintain continuous eligibility. During that time, our rolls grew from about 1,050,000 to to 1,375,000. So the Medicaid rolls increased about 30%. And so we went through the process of unwinding. That ended in last June, which contributed to a lot of the increase in CHIP. And so now we're probably at a new baseline in Medicaid, about 1,080,000 recipients. That's about 25 to 30,000 more than our traditional average. But with that, the enhanced FMAP went back down to our normal 72 to 73%. So what we've been doing in terms of, when I say educating legislators on how much we benefited from that 6.2%. We had significant carry forwards in terms of our general fund requests. So, I think last year was a little more than 200 million, the previous year about the same. So those carry forwards have diminished as our FMAP has diminished. And so we've done a lot of educating on that. And I would also say we've kind of been educating legislators on the importance of Medicaid. What is Medicaid? There's misconceptions in the public about what is Medicaid. For example, we're not Medicare. I think everyone in here knows that, but you'd be surprised. But we've done educating on simple things like we don't provide medical services. What we do is we reimburse the providers that provide these medical services. Over half of our 1 million plus recipients are children, which is more than half of this population of children in the state, more than 500,000, about 550,000 right now. And then we also educate them on the importance of what we mean to the provider community. We have about 34,000 providers that are currently enrolled in Medicaid, about 700 enrolled pediatricians at last count. And so we like to emphasize the importance of what we mean to the provider and their subsequent economic impact. So, I would say it's been an education process. Everyone has been very receptive so far. And like I said, I would characterize the agency's perspective is that we're optimistic and hopeful, and we appreciate any support that you can give us.
We also are very appreciative of the governor's office, the executive budget office, and the finance director, who have been wonderful in helping us think through our budget. I told y'all last year at this time, we were not asking for an increase. We wanted to sort of do some studying and look at pre-K. We had been growing for 10 straight years, had really exploded. We wanted incremental growth. Over those 10 years. We're glad to have it. We took a break from asking for increases for growth last year. This year, we're asking for two things, and they are showing up in the budget. We are asking to actually increase the per unit cost for pre-K. We know the cost has increased. We're trying to fund it. And so we've got some for that and some for expansion of pre-K. And so that is our biggest ask. We have seen an increase recommended in our budget. We're hoping it holds. We're also increasing our preschool to third grade or pre-K to third grade continuum partnership. We work very closely with the State Department of Education on everything from kindergarten transition, kindergarten entry assessment through a new early learning inventory, as well as funding kindergarten through third grade classrooms to carry forward those practices that we know work for early childhood. And then the other thing that you may have heard a little bit about Dolly Parton's Imagination Library, the governor referenced that in her State of the State. We have a small increase there. We are finally statewide in all 67 counties and every zip code going live with that. And so for those of you who don't know, that is a book mailing program. The state is covering half of the cost, and then local partners are covering the other half. And it is a program that is free to parents that provides one book per month for children ages birth to 5. And so by the end of it, a child should have a library of about 59 or 60 books. They're high quality, and it's really to help build that love of learning and to help support the Literacy Act, to help support parents. And so those are our legislative asks. They're very much budget related.
Ms. Hume, we'll start with you on this question since you mentioned budget. Please name one or two short-term legislative priorities. They can be state or federal level, non-budget agency that your agency is pursuing this year that could affect children, and how can we as advocates engage to promote that?
Well, we expect a bill to be dropped any day now to actually put Dolly Parton's Imagination Library permanently into the state. And Representative Terry Collins will be is our sponsor for that. I hope it's okay that I'm saying that. Never done this before, so this is all new to me. But so if I'm not supposed to say it, y'all keep it on the down low. But we are looking forward to a bill that actually puts the Imagination Library into code. And that's our only non-budget ask this year. We continue to monitor children's issues through the Children First Trust Fund and our partnership with the Children First Foundation. Glad to see Katie Jeter in the audience. And so we watch that. We've looked at that bill, and it looks like it's pretty much the same as usual. So those are our non-budget priorities.
Okay.
I would say for this session, there's really not many non-budget priorities. You know, as I mentioned earlier, our main ask is support of our general fund request, and that general fund request is about maintaining and sustaining the current program. And by that, I mean many in this room, reimbursement for the vital dental and pediatric providers and other providers in the state that are rendering services for our children. And so some sessions we do have non-budget related items, but that's the big one this year is our general fund request.
So we don't have specific bills that we are trying to carry as an agency, but there are a few that I'd just like to mention that are ones that we're supporting. Okay. One is SB 83. You may have seen it in the news. It's to add larger changing stations into new buildings. That's very important to our families. In fact, the lady who helped write the bill works for us as a parent consultant. We hire parents who are peer mentors to other parents with children with disabilities, and she has worked with Senator Orr on that bill. And so you may hear it called Changing Spaces. And so I'd encourage you to support SB 83 if you have an opportunity. HB 494, which is a presumptive eligibility for pregnant moms. We talked about infant mortality earlier. I think that's something we need to consider as a state, so we would be supportive of that bill. And then HB 52, which extends the sunset on ABLE accounts, which are so important to our families as well.
I would say outside of what I previously mentioned with the governor's public safety package of bills, there is not to my knowledge at this point in time, not a lot of bills that we are aware of or necessarily endorse. And there is a bill coming out of committee today that I will speak on. And but anything that seeks to put greater resources in the community, we are in favor of that. And so, however, I think what we need to be able to keep in mind as we, have greater efforts towards public safety is that we really need to focus on what matters and what works as well. So not just to cast a large net and, there's certain fish that you are trying to address, but sometimes you pick up others along the way that are, not intended to. And I think when you look at juvenile justice, especially if the momentum is getting tougher on certain crimes, sometimes you can also pick up unintended consequences with that as well. So, as these bills come up, I know that we are looking at them and making sure that we're, one, putting resources in the community where they really could do the most good, but also that they truly are effective in their intention and will receive or hopefully get the outcomes that are desired. So not all of them are designed that way. Some of them are good ideas and well-intended, but they're written in a way that they're not going to get those outcomes and results in the opinion of many. And so we want to make sure that we express that as well. So we're keeping an eye on that. I've heard there will probably be more bills coming forth about that. And we're keeping an eye on anything that has to do with juvenile justice and outcomes for youth.
We don't have specific legislation that we've introduced. So much of what we do in public health is just behind the scenes, and people don't know about it until something goes wrong. But the reason that you can go out to eat tonight and not worry about getting sick, or you can turn on your faucet and drink what comes out of it, has a lot to do with a lot of the work that's done by public health, and not only us, but others as well. But so many of those things are just things that we almost take for granted. I'd say the thing that we feel most urgent about trying to protect is just our ability to support immunization services for our kids. We don't know, what the future is going to hold there in terms of funding. Remember, half the kids in our state are essentially federally funded for their vaccine services. The VFC program is just a tremendous program. And so low-income kids, which is a large percentage of Alabama kids, allows those kids to be safe, which also keeps their classmates safe and keeps their family members safe. We have to maintain these certain minimum levels of vaccination so that we don't have outbreaks. There's a big measles outbreak in West Texas now, as you know. There's, I think, around 80 folks who've been infected that we know about. They suspect there were a number that they haven't picked up on yet. About almost 20 kids have been hospitalized to this point. If you live in the developing world, this is a normal daily occurrence. If you live in America, you don't think about measles. Measles is not something we know about. And I just mentioned to Dr. Mobley, I've been practicing infectious diseases for adults, not kids, but for over 35 years, I've never seen a case of measles because we don't think about that here. But besides this outbreak, we had 3 cases, travel-related cases in the Atlanta suburbs last month. So this is going to become a new issue for us. Again, I guess. Almost 100% preventable, almost 100% preventable. But you have to maintain really high vaccination rates. About 1 out of 5 unimmunized kids who get this disease will end up in the hospital, and some of them will die. So I'm not saying that to be alarmist. I just think it's what we expect would happen if we're not able to continue supporting these services. And so we certainly realize that it's not popular to talk about vaccinations now. It's a lot of the things left over from the pandemic. We get all that. We want to put out the right messages to people so that they don't feel like they're being compelled to do something or forced to do something. Certainly don't want them to think they're doing something unsafe. The people who say messages against vaccines really care about their kids and want their kids to be healthy. I mean, they absolutely do. And we appreciate that. We're just trying to find the right way to communicate them so that we can help keep their kids safe. So that's really our priority now, even though we don't have specific legislation about that.
Thank you.
Well, I would absolutely ditto that, because Dr. Harris knows, he and I have a lot of conversations about it. immunizations are a really important part of our conversation, something we're worried about because in fact, I called him a couple of weeks ago because I heard a rumor that we had a measles outbreak in Alabama. I said, where's there's a measles outbreak? And I don't know about it. Well, there wasn't. And it was somebody just, I guess, read a news story about another state. They had called an alarm. But it does sound the alarm because one case can lead to lots of other problems, especially with children who have immunity issues. And as all of you know, we've got a lot of children, some children who cannot take vaccines because they're immunocompromised. And then we have other children that even if they get the vaccines, because of other conditions, they can still catch, their immunity is so suppressed, they can catch something. So we need every healthy child to be, vaccinated. And he and I have talked about that. And I think there's a lot of confusion about the difference in, say, a COVID or flu shot and a polio shot. And they're two very different things. And, polio is something we've eradicated in the United States, but I don't know how many of you follow that. I mean, we were down a few years ago to like 2 cases in the whole world. And now I think there are a few hundred cases in the Middle East. So it's surging back. And if we've got to know that, we interact in a global society. So some of those people are going to interact with some of people who coming from here. And even if they're just traveling through an airport in Dubai, at some point it's going to, those viruses are going to be transported if we don't have those high immunization rates. We don't have any bills that we're filing. I mean, the budget is 99% of what we focus on every year because it's so huge. And of course, we do have the largest chunk of the state's budget goes to our schools. So we're following that very closely. We are working with leadership on a couple of bills that may get filed later this month or in March, but there's nothing out there right now. But I would say that I certainly support my colleague here. Anything you can do to help people understand the importance of childhood vaccines goes to support all of us.
Thank you. We don't have any legislation that we've actually gotten somebody to handle for us this year. We do support the adoption bill. That's something that has been worked on for a long time. It was passed a year or 2 ago, and then it needed some tweaking done to it. Jenny Schaefer had it in the House. She passed it, I believe, last week, and Arthur Orr has it upstairs in the Senate. So we expect that to pass, and that is a good bill. We generally have to track over 100 bills each legislative session, and one of our priorities is make sure no harm is done to the good things that are already out there. And that can be pretty scary sometimes. There is a bill that's probably going to get introduced. Don't want to talk about it today, but as soon as it goes in, we'll give it to Voices Group and they can get it all out to you because it's a horrible bill. And it's like setting the protection of children back 50 years, in my opinion. So we've told the bill sponsor, but we do think he's probably going to introduce it maybe tomorrow. So anyway, and then I'm glad Steve brought up about unintended consequences, because that is exactly what has happened in my opinion. I'm sorry I hadn't had a chance to discuss this with Steve, but we're right. They're not going to DYS, but they're going into the foster care system. And it's killing the foster care system. Our turnover rate was 64%. I'm glad we've gotten it down to about 50% now. But when you are putting kids that are arrested for attempted murder into the foster care system, you're causing great problems. We had 2 of them not too long ago in a county not all that far from here. And it happens, and it's not Steve's fault because they're not getting to DYS. They're being stopped at the local levels. But when you're trying to get young people out of college that want to help people to make things better, and they're having to babysit attempted murderers, and it takes 2 of them, sometimes 3, then it is putting undue pressure on the foster care system. That's not the majority of our kids, but a few of them can take up all your time. We talk about relinquishments. We're getting them because mom is scared to put them in her home. Mom is scared to put them in the home with her other children. Some of them have been selling drugs. Some of them, like I said, shot into occupied buildings. Some of them shot a man in the stomach, didn't kill him. And what's happening is they're being charged as adults. So why would you want a juvenile justice system that doesn't start earlier so that they don't end up their whole life being spent in prison because we didn't take care of them at an earlier age? So I don't know of any bills doing that this time, but if any goes in, I'll certainly work on passing them because something needs to change as far as those children. And if we don't change something in the foster care system, we're not going to find enough workers to work with us because you can't expect a foster parent to take a child like that in their home. That's just not going to happen. But our relinquishments are because of that and because of lack of mental health services. Last year, we spent over $100 million on mental health services. So when we're talking about money for mental health, DHR spends a lot of money on mental health services for children, as does the Department of Mental Health. But our money doesn't come from the Department of Mental Health. It has to go to DHR for us to develop the services. Our class action is because we don't have mental health services. We were just working on some other suits out there, and it's terrible to try to balance that and try to bring new workers in to work in it. So just wanted to share that with y'all this morning.
We'll be keeping our antennas up for what that is going to be. So we'll start with you. What are some strategic goals your agency is pursuing that will improve overall child well-being in the next 5 years?
Well, I think one goal of mine, I just talked about it, is to make sure nothing gets out there that causes a decrease in child well-being. We've come a long way in this state, and the chatter, or whatever you want to call it, that's out there now, some of it's pretty scary. And let's hope that that's not how the majority feels about some of the things that are going on in the state, whether it be vaccines, whether it be parental rights. I'm all for parental rights, but you know what? That little child doesn't have a choice which family he's born into. All the child deaths in the state pass across my desk, and parents do kill children. You don't understand how, but they do. So there has got to be a fine line in there where we can have some parental rights, but not to the fact that you actually harm a child, a helpless child that cannot talk. A lot of them can't even tell us. The pictures are horrible. And I can't imagine anybody wanting to pass a bill that would help facilitate that. Or sometimes they kill them and they bury them in the backyard. I mean, those kind of things happen, and that's the bad thing about DHR. Everything we do in child welfare is confidential. So you don't know what all goes on, but I will guarantee you one time, every time you see somebody being arrested somewhere in a county around the state for harming a child, DHR is in that case somewhere, even though I can't get out there and do a press release or I'll be sued on it. So it's out there, it's needed, and the more that you can help us tell our story on what people actually do that work for DHR and child welfare in particularly, kudos to you, and I thank you so much.
Well, you know, we'll work on the same things we've been working on. As was mentioned this morning, we got some good news. We've gotten 2 really good news reports in the last month on our elementary reading and math scores. One is the NAEP, which is it's only given, and it's important, but it's only given to 3% of kids. It's only given every other year in 2 grades. But we felt really good about it because it verified what we were seeing in our own state test data, which we, of course, give to everybody every year. And then you probably saw last week the Stanford-Harvard study that comes out every year came out and verified that and said that we're #1 in the nation in math growth and #3 in reading, behind Louisiana and Hawaii. So we felt really good about both of those. The good thing is the second study is not a NAEP study. It looks at actual individual tests that kids take across the country, and it's a pretty complicated statistical thing. But they started doing that right after COVID to see how the nation was recovering. So because those 2 things lined up with each other and they line up with what we're seeing internally, we feel pretty good about the investments the state's making. And we're going to have to double down on those investments. Again, almost everything that I deal with over here in this building is related to the budget. But an example would be we've gone very deep into extra classroom care and learning. So summer school, summer programming, summer reading camps and math camps. after-school programs, intercession programs. So what happens outside the school day, because we think that's really important. And it's especially important for children whose parents can't find them summer camps to go to or find them really good tutors to go to. So we have to fill that gap because, as already been said, I think some panelists mentioned that more than half of the state's kids, I guess, get public assistance for insurance. Well, they also get public assistance for everything else. So we now have 62% of our kids qualify for free or reduced lunch, not community eligible, with 62% qualified through what we call direct certification, which is working mostly with Commissioner Buckner on whether the family qualifies for food income or they qualify for Medicaid. And that number's grown. It was 54% about before the pandemic. It was 54%, now it's 62%. So our population of kids with needs growing. Now, back to my story, and I'll quit and let Dr. Harris talk about something better. But so we've been paying for all this summer enrichment and after-school programming and intercession programming with federal funds since 2020. And this year, the legislature has to pick that up, and they have. So for this, I don't mean what the budget they're working on downstairs now. I mean for this summer. So what was passed by last year's legislature, they had to pick up, about $100 million in additional cost that we had been paying for out of our federal pass-through funds, and those funds, of course, are gone. So we are going to see that we have to. We don't have any more state money, so we had to shift some things, and I think that's something you're going to see as a change this year and in the next few years. Is we have to look at what worked for us, at least for what worked with the federal funds, and what can we maintain. So just an example, we got over three cycles of federal funds, federal ESSER funds. I'm talking about the COVID relief ESSER funds. We got about $2 billion in our K-12 schools, about 100 million, in total, about 200 million of that stayed at the state level, almost all of which, 180 million of which went to pay for summer reading and those kinds of things. So really back to the schools. And the rest of it went to our local school districts. Well, that money's just gone, and there's just no way we can fill a $2 billion hole. So a lot of those programs will go away, but we have to figure out which ones we can support and which ones we can keep. And that's a lot of what we're focusing on. And so when you talk about the focus for the next 5 years, that's kind of it, is maintaining not maintaining where we are, but maintaining the trajectory we're on now, because obviously when you start pulling the legs out from under the stool, all of that could fall apart now that a large part of the funding has gone away.
Access to care issues for rural Alabamians, particularly low-income Alabamians, is really a really difficult situation right now. This is not new work for us, but over the next 5 years, we're going to spend a lot more time thinking about how to help address this. We're seeing hospital closures fairly regularly, as you know. A number of those closures aren't necessarily removing all services from the community. You may be aware, but about 2 years ago, the feds sort of created a new type of facility called a rural emergency hospital, which allows a hospital to receive direct payments from the federal government, but to close essentially all their inpatient services. So they're sort of like you could think of them like a freestanding emergency room. That's not exactly accurate, but they're basically, some services in the community, which is good for the community, but the hospitals themselves, with the inpatient beds, with the type of medical specialists that support inpatient care, those are going away, and they're going to continue to do that. Unfortunately, we're not a Medicaid expansion state. We don't have a good payer mix in most of our rural communities. Is probably the most neutral way I can say that. And so we don't expect that situation is going to change unless something else changes. So we are trying to figure out ways to help provide services if we can. Your county health department really doesn't have primary care services in most cases. We have these categorical programs where we do immunizations for kids, we do family planning for low-income women and men, and not a lot else. really, this is not the place you go, it's not an urgent care, where you can go and get primary care services. So we're trying to figure out what we can add there. We have added in the past year colposcopy services. If you don't know what that is, it's just a way of providing care to women that have abnormal pap smears, people that may be at risk for developing cervical cancer. We're doing that now in a number of our counties. We're really proud of that program. We've worked with Medicaid to figure out a way to make that program sustainable. They've been very helpful to us. We hope to continue to expand that program. Last year, the governor asked us to consider putting out a pilot program for providing maternity services in certain counties. And we really appreciate her confidence in us in doing that. It's been a really difficult work for us to figure out how to make that actually happen. We've identified a number of counties, mostly in Alabama's Black Belt, where we want to be able to provide prenatal services for women who maybe can't travel, who don't have another provider in their community, can't easily go 2 or 3 hours away. We are very close to kicking that program off, but I would say, what we've discovered are, all the challenges that are the reasons there aren't services in those communities in the first place. It's really hard to get providers to come there. It's really hard to figure out how to get them paid in a way that, makes it profitable for them to practice there. There are a lot of other additional costs that are on top of those programs, but we're committed to doing that. We really hope to have that up and running very soon in our biggest maternity deserts. It'll be for low risk women, and of course they still have to have somewhere to deliver. We're not going to do that in the county health department, so it's not a perfect solution. They're going to have to see a provider who's going to eventually deliver them in a hospital somewhere. But once they do that, then we hopefully can follow them if they're low risk moms in our county health departments with our own providers, which would be, save them, some travel time and expense and trouble. So those are the things that we're looking to do. We are never going to be able to supplant all the services that are unfortunately disappearing in rural parts of Alabama, but we're going to do our best. So.
The Department of Youth Services have been engaged in a strategic planning operation to try to improve our services internally and externally with our stakeholders over the last 3 years, and we continue to work on that plan. And the largest section of that plan really has to do with programming for youth. And one of the things that we are trying to do is not only increase the quantity of that program, but the quality of that programming as well that we offer when they're in our custody. And so bringing on additional types of therapeutic interventions. But one of the challenges that we have to still work through is that we have sometimes some existing classifications that were holdovers from the time when juvenile justice was more about custody and control. And then when we move to a more rehabilitative model, the same, qualifications of individuals who work for us may not have the ability to provide the services that we need nowadays. And so it's really changing the whole system internally through state personnel as well to get to the place where we can hire the type of staff that need to deliver the type of work that our kids need. For an example, we're seeing, just like DHR, more and more kids coming in with trauma issues that have had histories of working either receiving services from either DHR or mental health, and we need to continue those services when they come in with us as well, and not be able to continue to work on those issues that are present. I'm sorry that our sister agency and my former employer, Department of Mental Health, is not here today because it's a huge issue. And I know mental health is a huge issue across the whole country. And I applaud every effort the state makes to improve mental health services. But I would also say that we need to advocate for those services to trickle down to the youth and the children and families as well. I know you spend 80% of your life as an adult, and maybe most of the services need to be for adults, but we need to ensure that we can build a robust service provider system that serves kids as well. And so I know I have a young person in our custody today who is committed to the Department of Mental Health weeks ago, who's on one-on-one because of suicidal ideations and some attempts, but can't get into a hospital bed for that. I think they have 8 or 9 beds under contract, And there's a waiting list to get into those beds, and we've tried every psychiatric unit in this state to try to admit this child, and they would not take him. So we're around the clock with this young person, trying to keep him safe. Of course, we have a psychiatrist. We're trying to do everything we can, but he really needs another system other than ours. And so there's a challenge to be able to provide those services. But let me end on a high note. So a couple of things that we're excited about. Working with the Department of Medicaid Agency, they recently had new rules passed that they will now be able to work with young people 30 days prior to the release from correctional settings. And so we have been working with them all last fall to be ready to provide services and have our young people access their Medicaid and get reestablished with their Medicaid eligibility if they are eligible, and the case management services that they will help provide to link children to the services they need when they get back. Our agency really ends once they leave our door. We have no authority to provide any services beyond that time. And so sometimes when they walk out our gate, that's all we know what happens. We write recommendations to the court about what the child may need, but it's on the court to follow through with that and make sure that that happens. It's on somebody else to make sure that child makes that appointment that may have been set up for them, to make sure that they follow through and reestablish that relationship with either a behavioral health provider or medical provider. This particular initiative through the Medicaid agency, I think, will help in the years to come being able to make a more seamless transition back home and make or have our young people eligible for the services that they're eligible for and linked to the services that they need when they go back, because otherwise they'll be a revolving door and they may be coming right back to us as well. So that's one thing that is a priority for us moving forward that we think will have an effect in the next 5 years. The other one is that we're also excited that as part of our efforts to become more rehabilitative, we operate a school too. We have a school district embedded inside our department, and one of the areas that we have, since we can hold children until they're 21, a lot of times those young people earn their GED or their diploma with us, and then they can access the 2-year college system and begin to take classes remotely. And we've had a number of kids enrolled in classes and as well. And we've just signed a MOU with a 2-year college system to help provide job readiness programs and skill training. And so we look forward to them coming in to provide, and actually they'll come on site. So anything from forklift driving to skid steering to things I would love to do in my free time, but they actually are paying jobs. So we're looking forward to giving more opportunities for workforce development so that our young people have a chance to walk out and maybe walk into employment and not to the same fragile families and fragile neighborhoods that they've come from, and maybe have an opportunity to begin to earn a living and move on with their lives successfully.
So I'm sure everyone in the room knows this stat that I'm going to share, but 85% of a child's brain is developed within their first 3 years of life. That's why Alabama's early intervention system is so important, particularly as we're reaching out to families who have children who have developmental delays. And one of our goals in the last year, we're about to complete the process, is that we looked at that program to determine how we could make it more efficient and more fiscally responsible, because we have grown in that program year over year, no less than 400 additional infants and toddlers per year. This last year, we grew by a astounding number of 768 additional children. But what we also know is that we're not reaching all of the families that need us. In fact, we're only reaching a fraction of those families. And so one of our goals in the next 5 years is to implement those new rates that we've been fortunate enough to work with Alabama Medicaid to increase those rates. We have changed our case management system, and we have moved from a capitated rate to a fee-for-service model. That will go into effect on March 1st. So we're very excited about those changes and about our ability to see additional children and hopefully to provide I don't know if any of you know who the infant and toddler coordinating folks are, but they send out stats about how we're doing excuse me, as a nation and as a state in meeting the needs of those children with developmental disabilities. In Alabama, our early intervention system only sees families on average about 2 to 2.5 hours per month with therapy services. Across the country, that average is closer to 4 hours. We hope that these additional efficiencies and our increase in rates will also be able to provide not only services to new families, but increase the services that are being provided to the existing families within our system. A couple of other things is we hope to continue to expand our autism diagnostic services that we've expanded across our state into 5 nonprofit early intervention programs, and then 2 of our partnerships between 2 of our divisions, early intervention and children's rehabilitation. Our goal is to try and decrease the age at which a child is diagnosed with autism in Alabama. Right now, it's around age 4. And our hope is that we can get to those families earlier so that those therapeutic services can be provided earlier in that child's life. We also want to continue to expand our NICU follow-up clinics that we've now started in 2 of our children's rehabilitation offices. We're having really good response there. We're also in the process of building out an audiology mobile unit. We used COVID dollars for that. We'll be able to go into rural areas and do hearing screenings for infants and toddlers at an earlier age, and so that those families don't have to try and travel to our children's clinic. And then last but not least, we're going to take some of those reallotted dollars that I talked about earlier and increase work-based learning opportunities for those students in high schools across the state who have a disability. We know that work-based learning really is the equalizer for our students, and so we're very excited about increasing those opportunities in the future.
So over the next 5 years, one of the objectives, quality initiatives of the agency will be to continue to improve the ACHN program. The ACHN program, most of you probably know, the Alabama Coordinated Health Network. It began in 2019. So this past fall, we entered into a new contract over the next 5 years. So there's lots of lessons learned over the first 5 years of the program. The program itself is a statewide case management, care coordination system that connects patients to providers, community resources, among other things. We have 7 statewide entities, and we have about 500 or so participating PCP groups that are really the engine that drives the ACHN. And so some of the lessons learned include we really weren't doing a great job of capturing social determinants of health. So one of the things that we are requiring in this new contract is for every care plan, we need to document social determinants of health. We're starting with 4. Transportation issues are rising to the top, not surprisingly, as our #1 social determinant. But there are others such as domestic violence, housing insecurity, among others. Another focus of the new contract will be on children with medical complexities. It's really too early to say how the outcomes are going to be measured with that particular group, but that was one of the gaps that we heard from providers. Obviously, we'll be working with our sister agencies on that population. We also transitioned our family planning case management back to ADPH. We thought that was the #1, the optimal place for it to be, and that's something we hope that will improve a lot of the outcomes of the program. The outcomes of the program do remain the same, and that's around childhood obesity, substance use disorder, and infant and maternal mortality. So, our providers and the ACHNs, they have several quality initiatives focused around these 3 outcomes. We also have incentives for both providers and the entities, really focusing on immunization rates. There's family planning metrics as well as maternal health metrics. So it's something that we knew the ACHN program, moving the needle would be a long-term process. We know it needs to move quicker, and we hope that this revamped contract over the next 5 years, we start to see some improvements in those metrics. So that's one thing. Also, we are going to continue to hopefully expand the Nurse Family Partnership Program, the NFP program. That's a program that began 2 years ago. We began enrolling providers. We were approved by CMS in 2022, began enrolling providers in 2023. And since the inception, we have served over 1,500 families. And essentially what the NFP program is an intensive home visiting program designed to target first-time high-risk mothers, and it follows the mother from the prenatal phase to the child's second birthday. And so again, that's one where we are in evaluation phase right now, and we hope that, again, there are several outcomes that we hope to see in the next 3 to 5 years. Right now, it's about 30 counties, I want to say at last count, maybe 32 counties where we had NFP providers enrolled. Ultimately, there's not a set timetable, but over the next 5 years, the ultimate goal is to expand into all 67 counties with the program. Another just quick thing I would mention would be a recent grant that the Medicaid Agency was just awarded from CMS. It's called TMAH, if you've heard of that, TMAH, the Transforming Maternal Health Grant. We are one of 15 states. We think most of the 50 states plus territories applied for this, so we were fortunate to be awarded a 10-year grant totaling about $16.5 million. And essentially what the grant does is going to assist the agency with creating an alternative delivery system and payment model targeting mothers. We have not identified the pilot areas yet. It could be statewide. We might focus on some other areas within the state, such as Black Belt counties, but that is in its infancy. We just had our first meeting with the CMS project manager. And so that's something we don't anticipate any of the new federal regulations to impact that, but that's something we're excited about. And again, hopefully can move the needle with really not only maternal metrics, but postpartum metrics as well. And then finally, I'll end with what Steve already mentioned. What we are referring to internally at Medicaid as our Justice Involved Youth Program. And essentially, as Steve mentioned, we will be working closely with the Department of Youth Services to essentially provide the EPSDT, well child screenings, among other services to the children that are incarcerated 30 days prior to release or as soon as practicable. That's the language that CMS uses, practicable. So that's something that in partnership with DYS, we've been working closely with them since last fall to develop processes to not only get the applications to the incarcerated youth earlier, but to also start to develop processes to embed providers, EPSDT providers. There's going to be more information on that for our pediatricians in the next several weeks. We hope to recruit EPSDT providers to augment what DYS already has. And in addition, we will also be providing targeted case management services, both 30 days pre-release and at least 30 days post-release. And at this point, we are currently enrolling the current ACHNs as the targeted case management providers that will be providing these case management services. So that's something we're really excited about. We're literally in our introductory stages, and we hope to start recruiting providers and enrolling providers within the next 2 weeks. So I'll turn it over to the next panelist.
Thank you, Barry. I think of all the alphabet soup that you just gave us. I knew NFP. We've had Nurse Family Partnership in our department for many years and are so excited that Medicaid has really taken this on. So our top priorities for the next few years, we have lots of data that tell us that pre-K works and a lot of our programs work statewide. Now we're diving into what's working for whom and where, what can we learn from that? And so we're doing that for first class pre-K, for our P3 program, for our first teacher home visiting program that includes NFP as well as parents as teachers and HIPPY models. We're also looking at We're very thankful to the State Department of Education for partnering with us on the kindergarten entry assessment, which is now Alabama Eli, is what we're calling it. Love to see the fans in the back. Thank you, Beth. And we're really looking at like what's working for children, both at kindergarten entry and third grade. What are those data points telling us? What do we know that's working during the time that children are in early education programs? One other thing that we're working on and we've seen is we're trying to prevent some of the things that Commissioner Buckner, that Steve Lafreniere's talked about, that Dr. Mackey's talked about, that everyone's talking about, and that is we're trying to prevent exclusionary practices in early childhood settings. What does that mean? That is, children are being dismissed or suspended because of behavior or trauma, and those behaviors are really challenging in the early years. So what can we do for children from birth to age 5 to really help with that area? And so we're partnering with the Department of Mental Health through the Infant and Early Childhood Mental Health Consultation Model. We're partnering with ADRS. I love this back in the group. We've got Amy and Beth back here cheering. We've got ADRS, we're working with them on the autism piece. We're working with DHR through both EHS, CCP, and the Quality Stars improvement, and supporting that with some challenging behaviors, coaching, and work. And then also working with special ed at ALSDE. So as you know, it's a very complex issue. We're starting early, and we really see an increase in those behaviors. And so we're trying to figure out, what does a system of care look like? We want to support the teachers, we want to support the families, and we want to support the children. Something else that we're working on is really supporting and empowering parents through Dolly Parton's Imagination Library, First Teacher Home Visiting. We have Born Ready University programs around the state. We are launching a 90 by 5 campaign. So I'd love to take what you said, 85 by 3, we're doing 90 by 5. 90% of a child's brain develops before they're 5. And we want to help teachers, but also parents understand that they play such an important role. They are their child's first teacher, and how can we support them? Reach Out and Read is one of those programs that we're supporting. So we are excited about partnering with ALAAP on that. So we're just excited to be really working on how do we help support parents as their child's first teacher to understand that it's not rocket science. It's about reading, singing, playing, talking, having those conversations. And then finally, probably the least glamorous part, but it's workforce development. We don't have the early childhood workforce. And so we're very excited that our office is a sponsor agency through the Alabama Office of Apprenticeship. And we have apprentices around the state. We have a great director right now who is quietly growing this program beyond belief. And I'm signing certificates every day for people who are going through the apprenticeship program. We're supporting the Child Development Associate credential, and then also continuing to provide scholarships for those seeking a degree in early childhood education.
Thank you so much. Each of you have provided advocates with a wealth of information that we can take to legislators today in support of each of your departments. We thank you so much for your time and participating in a panel, and we thank you for the work that you do on behalf of children in Alabama. Thank you very much.
Yeah. Thank you. It's my pleasure to introduce Doryan Carlton, who's the state budget officer. And so whenever I have a budget related question, I always call Doryan because she has the answer. And she's going to give us kind of the 10,000 foot level view of the budgets and kind of what they're dealing with this year. Doryan?
Good morning, everybody. Y'all have a panel of like all of our favorite department heads. So I think y'all probably already know everything that I'm going to tell you guys about, but I'm going to hit some high points on the budgets because I wanted to make sure that I left some time at the end in case you guys had, any questions. But I first wanted to talk about the situation that we have this year with the budgets. Education budget's in great shape. Revenues are starting to stabilize, but there's this thing called the rolling reserve that caps appropriations. I don't want to get in all the weeds that us number nerds like, but education's fine. But where the struggle is starting to come in is with the state general fund. There's been lots of stuff out in the media, but interest on state deposits, we've earned about 500 million last year in the general fund. We normally get 20 or 30 million in a year. So if you can see, that's a big, huge amount. Interest rates are starting to come back down, and deposits in the state treasury are starting to come back down significantly with all the federal money leaving. So with that one factor alone, once that interest goes away, it's $500 million in revenue that the general fund won't have coming up in future years. We don't think it'll all happen in one year, but it will happen over the next couple of years. But this year we're fine. It's just tight. Probably some of the agencies, well, you do get some general fund money, don't you? Okay. So the ones funded out of the general fund might disagree, but the budgets were stable this year. A lot of people didn't get huge increases, but we were able to maintain at least level funding and small increases for people. But a couple of things that happened in the general fund budget that are big that I think you guys will be interested in. Of course, Medicaid was fully funded, an additional $230 million. I know Dr. Harris was here earlier, so he probably already told you guys CHIP got fully funded. It's another $28 million, which is a pretty big increase for for 1 year, a 50% increase just in funding from the general fund over 1 year. So that's pretty significant. But of course, the governor and the legislature are very committed to, the All Kids program is fantastic. It ensures a lot of kids with Medicaid and the unwinding. We had a lot of kids shift from Medicaid back to CHIP. So that caused the CHIP numbers to go up. Other significant things that are in the budget that I think you guys would be interested in. And let me say, if I don't hit on something that you're interested in, ask me, because Hunter is here from my office. And if y'all ask me a question, I don't know off the top of my head, it's his job to look it up real quick. So so we can make sure we get you guys whatever you need. But we increased funding to the Child Advocacy Centers this year. Pretty significantly for their operations over from fiscal year 21 to the 26 budget that the governor's recommendation, it was a 97% increase in funding. And I can tell y'all, I've been in this role since, I've been in this office since 2001, and I started when I was 12. But I would have never thought that we could make those kind of significant investments in something that is just so needed. So that was a really good thing. Had a 40% increase for spending on the Numeracy Act. I know you guys are all, you're voices for the children. So you know what all of our stats have been with the NAEP scores, which is amazing. I hope that Dr. Mackey bragged on that while he was here. But a 40% increase for the Numeracy Act, another significant increase for the Literacy Act. We're up to, I think it's 34th in the U.S. for fourth grade reading. Fantastic. On math, with the additional funding for the Numeracy Act, we're going to end up having 683 math coaches in the schools around the state. So we anticipate with that going in 2026 that those scores will continue to increase in future years. So significant investments there. Summer school and after school programs, an additional 30 million in the supplemental for that, and another 14 in the regular education budget. We also put about 5 million in for behavioral analysts for the children with autism. So that's going to be able to fully fund one behavior analyst per district for autism support in the schools. And I think that's a fantastic addition. We also did some increases in pre-K. I see Dr. Hume's already gone, but significant improvements for pre-K for them to be able to increase the grant sizes that are going out for existing programs, and then to still expand for additional programs. Of course, the funding stayed in for the summer EBT program. I know that was a big thing that you guys fought for last year. It stayed in the budget. It'll be in the budget for this next year. We also put some additional money in for childcare and the QRIS program that Commissioner Buckner may have spoken to you guys about, that's at DHR. So are y'all familiar with what the QRIS program is? Okay. So she really believes in that program and feels like it's gotten not just more daycare options, but quality, because quality is, more important than quantity sometimes in some things. And she really believes in that. And so the governor is backing her on that as well. I think I might have hit of everything on my major highlights. But is there anything specific that you guys want to know if we covered it in the budget? I mean, y'all are quiet. Okay.
Thought about the potential for federal cutbacks on anything? Is there anything really worrying you at this point?
Let me give this disclosure before I answer this. I'm speaking for myself and not for the governor or anybody in the administration, okay? Because sometimes when I give my opinion, I don't want to be it to be allocated to her or anybody else. When they shut down the federal funding on, I think it was a Monday, no, it was a Wednesday. I think it was a Wednesday. It was 2 days before payroll was supposed to run. So whatever day that was, like I went in a full-blown panic because I'm like, if you don't look at the numbers behind the scenes, you don't realize how much federal money comes to our state. When Medicaid can't draw down money, we can't pay the hospitals, we can't pay for ambulances, we can't pay doctors, all those services that were already provided. And we couldn't draw down anything. And my first thing, how are we going to make payroll? I mean, we got to pay people and we have to pay all these institutions. So luckily the TRO went into effect and the money started flowing the next day. But I had a full panic, like complete meltdown, because it's a scary thing. We've been through government shutdowns before and we can kind of plan for that because most of the time when you have a federal government shutdown, it doesn't affect Medicaid dollars. It doesn't affect, the big things that we get. It's usually discretionary things and you can kind of plan for that and for cash flow issues. We don't have as much discretionary as we do mandatory programs. But something of that magnitude, I've never been through. And it was a little scary. So I'm glad that it got opened back up and we're back to, it seems like we're back to business as usual, drawing down money. I actually had a department head in my office just a few minutes ago. He's from an agency that's not, healthcare related, or it's like energy kind of stuff. And he said that all of their things finally got back online this week. So they were gradually putting some of the programs back online, but even they've been able to draw down all their money. So hopefully we will handle it with a chisel instead of a sledgehammer. That's what we hope for. So.
Doryan, could you give them just a little 30 seconds on the challenges of the general fund in the out years?
Sure. Okay. Okay. So when I was talking to you guys about the interest on state deposits and how that is such a big deal for the general fund, we've been able to get that money for the last couple of years because for the first time, and you'll probably understand this since you asked about federal funds, most of the time when the state gets federal funds, we have to turn around and pay that money out in 24 or 48 hours, and we have to pay interest back to the federal government. Then they do that so that we don't draw down federal money and hold it, to create cash flow problems at the federal level. When we got all the coronavirus relief fund money, all the COVID money, all the ARPA money, we got to keep that money in the state treasury. They just sent us cash and we got to hold it. And we've been able to earn interest on it all this time. The coronavirus relief fund was $2 billion. The ARPA money was $2 billion. And that whole time, the state's been able to earn and keep the interest on it. And when the interest rates went up, that's a significant amount of money. So that's how we were able to get so much additional revenue. All the interest on state deposits comes into the general fund. With that going away, even though we have a few other growth revenues in the general fund, they will not grow enough to offset that loss. But I will say, so that we don't panic, a lot of that extra money we've used for one-time projects. We've really tried to do some capital things or some one-time things to prop people up that they're not going to need continuing operating funds. But as you guys know, Medicaid is the biggest driver in the general fund. And so whatever they need, we need to give it to them. It's not like they can control what their payments are. So we do have that. However, we do have a couple of growth revenues. So one of them is a simplified seller's use tax, which I refer to as the Amazon tax. So how many people get y'all may be a lot more financially responsible than me, but how many of you guys get an Amazon package every week? I get one and then I can't even remember what it is, because it's so easy. Well, all of us did that during COVID. And then all of that kind of stuck. We weren't expecting it to stick as much as it did. Even we got used to having those conveniences at our house. A large portion of that money comes to the general fund. You can thank Jay for that. Because it used to be almost all the growth taxes were on the education side. And so the general fund, which funds, us regular boring pieces of government, it didn't really have any growth taxes, but that's a significant one. Insurance premium tax. Has anybody who has not had a significant increase in their homeowner's insurance or their car insurance? Because if you hadn't, then I need to know whoever your insurance is with, because mine's increasing like 25, 30% every year. Well, the insurance companies pay a premium tax on that premium that you pay them, and that also comes to the general fund. So both of those are growth revenues, which we are seeing significant growth, but it's not going to be enough to take away the losses we're going to see on interest on state deposits. So overall, it'll be steady. We shouldn't see like big cuts, but we're not going to see big increases in the budget past this year for a few years. Yes, ma'am. Absolutely. I'm on that committee too. I mean, come on. So they should be meeting, I would assume, in the next couple of weeks to try to determine the next round of opioid money, how much they're going to get out. I want to say the RFP is out now. If y'all know anybody that is eligible, mental health is running that program to get out some of the opioid monies out to institutions, a lot of nonprofits and things that are handling that. The opioid money is coming in, but it's also like, kind of like the tobacco. We've gotten tobacco money, Children's First. Sure, you guys know what that is. Yeah, shout out to the back. The Children's First money, it's not going to grow. Opioid money is going to eventually run out too. So they're trying to do a lot of grant programs and things like that for nonprofits. I would imagine, I think they did 30 million in 24. I feel like they'll do another 30 million this year. But I don't know that yet. I mean, I can't say for sure, but that's what I would think. So if you got ideas, bring them to us. So, yes, sir. Sure. Can I filter that through you?
Yes. Yeah.
Okay.
Yeah.
I'll send it to Jay and let him send it out to y'all. And I'll get it from Dr. Hume, who's in the back. She'll give you all those details, but absolutely, we will. Some of it's for expansion, and then some of it's for existing programs. Some of those areas, I don't want to overspeak on your program, because if I say something wrong, you better correct me. But a lot of things are more expensive than they were several years ago. And so they need a little bit of extra money, to run those programs. And we also took away, parents paying tuition. There were some areas that parents were paying tuition, and the governor really wanted to make it free. So that's what those increases, but we'll get you details. Okay. Anything else? Well, all right. Thank y'all for coming to the State House today. Okay.
So we are coming to the end. I'm just going to give you a brief update about the legislative session. So yesterday was the 7th legislative day. Tomorrow they'll meet again. That'll be the 8th legislative day. The Alabama legislature can only meet 30 legislative days in a regular session, and usually runs from the first part of February to the middle of May. So over the next several weeks, 2 or 3 months, you're going to see a lot of activity going on. You'll see a lot of press conferences. You'll see a lot of bills that are introduced. I will say this year has been an exceptionally busy year compared to last year. It's been about 50% more bills introduced this year than were introduced last year. So that's created a lot more activity. There's a lot more bills in committee. You're kind of seeing that today with all the activity and people in the State House. And the first part of the session usually is focused on the priorities of the caucuses, of the House Republican Caucus and the Senate Republican Caucus and the governor's office. And so the first part of the session typically is focused on what they call priority bills that the leadership has, and that's been the case this year. Yesterday was the crime package, in the House last week was an immigration package in the Senate. So you'll see those bills of the legislative priorities over the next few weeks. And then you move into the budget discussion and the budget hearings. And those are usually about around the 9th or the 10th legislative week when they're meeting around the 20th legislative day. And so the governor has introduced budgets. I think they've been pretty well received over here, as Doryan mentioned, and just my conversations with some of the budget chairmen. So they'll make changes, but all in all, the budgets are in good shape. And, you know, that can be a difficult time when they're talking about having to make cuts. They're not having to do that this year. So it's been good. A few bills just on the radar out there. There's House Bill 26. That's Representative Ensler. That's a gun Glock switch bill where you can turn essentially a handgun into a machine gun. And that bill's got bipartisan support. The governor supports it. So I would anticipate here in the next week or two that bill will make it through the House. It made it through the House last year. It got hung up in the last day on the Senate. So hopefully that will pass. Representative Faulkner has introduced a bill, House Bill 235, that deals with, the requirement by social media platforms that you can't allow anybody under 16 years old from creating an account on social media. A lot of mental health issues in the last several years have been driven by social media and its impact. So that's a new bill that's being introduced. So we'll see where it goes. Representative Lands passed a bill out of House last week that deals with the presumptive Medicaid eligibility for pregnant women. Prior to that, they had to prove that they were Medicaid eligible. If this bill becomes law, which she passed out of the House, there's a companion bill in the Senate, that they will be required to assume that woman has Medicaid eligibility until they can prove that she doesn't have it. So that's just a good government bill. It's got a very low fiscal cost related to the state budgets. And so those are some of the bills that, you know, are starting to make its way through the process and, you know, what we'll deal with over the next couple of months. I'm assuming many of these y'all are going out and kind of meeting with your legislators. They're very approachable, just open with a smile. Everybody likes to see a smiling face. Just introduce who you are, that you're here for voices and what, you know, your issue is and what you'd like to talk to them about. And and just kind of not try and, you know, overwhelm them with information, but just kind of keep it brief and just tell them, you know, the priorities that we are concerned about and what we're here for. And like I said, they're very approachable but a smile always helps. So anyways, it's that.
Any questions?
Any questions?
I know we're running short on time. Thank
Yeah.
you so much, Jay. So he
Keep
ran
everybody from
through this
lunch.
really fast. So I'm not going to hold you long. I just want to say a couple of things. So thank you, all of you, for coming out. And as I was sitting here, I was thinking, I don't know how many people really know what is an advocate. It is putting pressure on the people or the entity that have the power to give you what you want. And that definition works at all levels. For everything, even your children. If you have small children, they cry. When they're wet, they're hungry, they're tired, they are advocating for their needs. It's that simple. If you need a reason to go by your lawmaker's office, we have these little cards printed up, and you can write a very short note, and it has voices, some of our top priorities for this session, and it would give you a reason to go by. And if he's not there, he or she is not there, you could leave the card. If you aren't able to do that, we'd still ask that you write down, use your home address so your lawmaker knows your constituent, and we would be happy to distribute those as well if you don't have the time to do it. But while you're here, I hope you'll take time to be a part of the process. Go sit in a committee meeting. I don't know if they're going into session today. Okay, yay. We never know what they're doing on any of the 3 days they're here. But it is an interesting process, and if you've not ever been to the Capitol or the State House to watch that happen, it's worth your time. It's worth delaying leaving. The last thing I'm going to say is we didn't feed you this year. What we have, we've got water and snacks outside the room. Please go by and pick up because I must have been hungry when I bought. I had bought a lot of snacks. And if you're with the pediatricians group, just forgive me. They're not all healthy. So I was just looking for something sustaining that you could grab and go and eat. So thank you for being with us, and we hope you'll come again next year. You're dismissed.
Smoke-free bill down there. How are you? Good to see you. Hey, Sue, good to see you.